Assalamu alaikum to students. Today we are here to discuss another biomechanics topic. Today we will talk about the biomechanics of the ankle foot joint, or we can say the ankle foot complex. In this lecture, we will talk about the general overview of the foot anatomy. Then we will discuss the ankle joint general consideration, proximal joint surface of the ankle joint, distal joint surface of the ankle joint, capsular support of the ankle joint, ligamentous support of ankle joint, osteokinematics of ankle joint, and then the orthokinematics of the ankle joint. So let's start. The ankle foot complex is structurally analogous to the wrist hand complex, but there are some difference. और वो difference क्या है? अगर हम हाथ की तरफ देखें तो एक तो यहाँ पे जो कार्पल बोन्स है दे आर 8 in number, लेकिन वहां पर जो टार्सल्स है दे आर 7 in number. Another major difference is that हैंड जो है इस पे कोई जो है वेट बियरिंग नहीं है. ऑन द अदर हैंड अगर हम देखें जो एंकल एंड फुट कॉम्प्लेक्स है, इसका एक मेजर रोल उसमें भी है कि ये वेट बियरिंग जो है उसमें इसका रोल है. तो ये एक बहुत बड़ा डिफरेंस एंड दैट इज द रीजन. इसके अगर हम स्ट्रक्चर देखें सो द tarsal structure देखें as compared to the carpus, they are larger in size. Just like calcaneus and talus, they are very, very large as compared to those bones which we are here at the carpals. So that is just because to fulfill that demands of the stability to bear their weight of the body. The structure of the foot, they allow the foot to sustain large weight-bearing stresses under a variety of surfaces and activities that maximize stability and mobility. The ankle foot complex must meet the stability demand of providing a stable base of support for the body in a variety of weight-bearing postures. Weight-bearing posture mean when we are in standing position, when we are in sitting position, when we are in sitting position without having any seating surface. In all these positions, the ankle foot complex have a role to bear the body weight without excessive muscular activity and energy expenditure. And the second, which is the main function of that ankle foot complex, that it acts as a rigid lever for the effective push-up during the gait. Gait means simple walking. The scientific term for that walking is gait. Gait is made up two phases. This is the stance phase and the swing phase. Then stance phase is divided into 5 more phases according to their traditional classification. The first one is the heel strike. Then this is the flat foot. The third one is the mid stance. Then this is the heel off, and the last one is the toe off, which we can also call as the push off. So that's ankle and foot complex that act as a rigid lever for that effective push off during the gait. While the swing phase, and that is then consists of the early swing, the mid swing, and then the late swing. We will discuss the gait different parameters as well as the gait detail in the end of this lecture. The stability requirement can be contrasted to the mobility demands of it's really being flexible enough to absorb the shock of the superimposed body weight as the foot hit the ground and permitting the foot to conform to a wide range of changing and varied terrain, as we can see when we are going on a track. So there may be a smooth surface, there may be a very rough surface, there may be uneven surface, there may be stony surface, there may be soft surface. So there is a conformation for that wide range of these varied terrain. If we talk about the general anatomy of the ankle foot complex, So as an overview, the ankle foot complex that total have 28 bones, and these 28 bones that form 25 component joints. Among these 25 component joints, the joints include the proximal and distal tibiofibular joints, the talocrural joint, which is also known as the ankle joint, the talocalcaneal joint, also known as the subtalar joint, the talonavicular and the calcaneocuboid joints. These both are combinedly known as the transverse tarsal joints. Then the 5 tarsal metatarsal joints, the joint between the tarsals and the metatarsal, 5 metatarsal phalangeal joints, and 9 interphalangeal joints. So if we combine all these joints, 9 plus 5 plus 5, that make 19. 19 plus 2, 21. That's 22, 23. And these proximal and distal two joints that make total 25 component joints. And all these 25 component joints of that ankle foot complex, they are made of total number of 28 bones. Among these 28 bones, 7 of them are the tarsals, then 5 of them are the metatarsals, and the remaining they are the phalanges. So let's start from the proximal tibiofibular joint. This tibiofibular joint is not the part of the knee complex, though it is in the neighborhood of the knee joint, but it lies outside of that knee joint capsule. That's why it is considered as the part of the ankle joint complex rather than the part of the knee joint complex. This proximal tibiofibular joint, this is the plane synovial joint, which is formed by the articulation of the head up fibula with the posterior lateral aspects of tibia. So what we mean by the plane synovial joint? Plane synovial joint mean in which the articulation surfaces, they are very plane with each other. There is no concave, convex surfaces. There is no saddle surfaces. Both surfaces, they are smooth and plane, and there is only gliding between these two surfaces. There is no other large moments like which we can see in the other joints. Each proximal tibiofibular joint is surrounded by a joint capsule that is reinforced by interior and posterior tibiofibular ligaments, which we can call as the interior and posterior proximal tibiofibular ligaments, as there are also tibiofibular ligaments in the distal tibiofibular joints. So the ligaments of the distal joints, we will call them as the interior and posterior inferior tibiofibular joint ligaments, and for the upper joint, we will term as the interior and posterior superior tibiofibular ligament or the proximal tibiofibular ligament. So this is that interior tibiofibular ligament, which is the ligament surrounding that proximal tibiofibular joint. Just above the interior tibiofibular ligament, there is a small ligament, which is the popliteofibular ligament. That is the ligament which connects the one attachment is on the fibular head, while in the other end that is attached to that popliteus muscle. So this is the anterior view of that proximal tibiofibular joint. This is that lateral popliteal nerve, which is lying inferior to that proximal tibiofibular ligament. This is the posterior view of the proximal tibiofibular joint. These are the ligaments, which is known as the posterior proximal tibiofibular ligament. Just superior to that posterior proximal tibiofibular ligament, on the superior posterior surface of the fibular head, there is a ligament which is known as a group of ligaments. There are 3 actually ligaments, and all these three ligaments combinedly called as the arcuate ligament complex. Remember one point, this arcuate ligament complex, they are very associated with the ACL injury, and almost in 90% cases of the ACL rupture, there is rupture, there is sprain of this arcuate ligament complex. And when there is sprain of the arcuate ligament complex along with ACL rupture, this sign is known as the arcuate sign, which is actually a secondary sign on the MRI findings of the that ACL rupture. This is a triangular shape, posterior small muscle, that popliteus muscle, that is the popliteus tendon, that is that muscular end of that popliteus muscle. That is the posterior view, and that is the interior view of the proximal tibiofibular joint. The moments in these joints is just gliding against each other. There is no such other moment at this joint, and that's why this joint is known as the plane synovial joint. The distal tibiofibular joint, this is a syndesmosis, and which means a simple fibrous union. This distal tibiofibular joint, that is not an actually joint. There is no actual contact between the tibial surface and the fibular surfaces. Between the concave facet of the tibia and the convex facet of the fibula, there is some structures which we can call as the fibroadipose tissue. These fibroadipose tissue that separate these two surfaces, and due to that, they actually do not come into contact with each other. Although there is no joint capsule, there are several associated ligaments at the distal tibiofibular joint, and these ligaments, they are combinedly known as the high ankle ligament. And when there is sprain to these ligaments, then there is a term in medically which is known as the high ankle sprain. So there is two separate terms. One is the ankle sprain, which is actually the sprain of the ligaments of the lateral side and middle side ligaments of the ankle joint, while high ankle sprain, that mean the sprain in the distal ligaments of the distal tibiofibular joint, which is actually known as the high ankle ligaments. Because the proximal and distal joints, they are linked, all the ligaments lie between the tibia and fibula contribute to stability at both joints. One difference between the distal and proximal tibiofibular joint is that, in sense of that ligaments, there were only two ligaments at the superior joint, which is the proximal tibiofibular joint, and these two ligaments were the anterior and posterior ligament. But inferiorly, the distal tibiofibular joint, there are three ligaments which are supporting this joint, the distal tibiofibular joint. One is the interior and posterior inferior tibiofibular ligament, and the other is the transverse ligament, which is present on the posterior surface. So we can see here, this is that tibia, this is that fibula, and this is the posterior view. This is the medial side. This is the lateral side, the fibular side, and this ligament is known as the posterior inferior talofibular ligament, while this IO, that is the interosseous membrane. Interosseous mean the membrane between the two bones, that interosseous mean between the bones. Here, this is the interior inferior talofibular ligament. This is the lateral view. This is the interior. This is the posterior. And if we look at here, this is that posterior view. Here are two ligaments. One is the posterior inferior tibiofibular ligament, and the other ligament which is deeper to that posterior inferior tibiofibular ligament is the transverse ligament, while on the interior side there is a single ligament known as the interior inferior tibiofibular ligament. This test is known as the squeeze test. If someone have the high ankle sprain, then this test, the squeeze test, is a provocative test for that injury, which we call as the syndesmotic injury. Syndesmotic injury is another term for the high ankle sprain, and in this test, the therapist that actually compress the tibia and fibula from the both sides through the hands. This hand will just compress from that side, while this hand will compress from that side. So these compression will be against with each other, and if during this compression of the two medial and lateral surfaces against each other, if the patient feels some pain at this area, then which is that there is indicating this area. If there is pain at that area after squeezing of the medial and lateral surface against each other, then it is a positive test for that syndesmosis injury or the high ankle sprain. But if there is no increase in the intensity of the pain after squeezing these two surfaces, then this test is negative for the high ankle sprain, and then there may be the ankle sprain. So these are the proximal tibiofibular joint, while this is the distal tibiofibular joint. You can see here that there is no direct contact between the two surfaces. This is interosseous membrane, the membrane present between the medial surface of the fibula and the lateral surface of that tibia. This is the head of the fibula. This is the proximal tibiofibular joint, which is actually a plain synovial joint. These two are the lateral and medial condyle of the tibia. This is the tibial tuberosity, जहाँ पर ACL जो है अटैच होता है. Sorry, जहाँ पर जो patellar tendon होता है, that is attached here to the tibial tuberosity. While these are the intercondylar eminence. अब आते हैं towards the ankle foot complex. हमने हाई एंकल जो है उस पर बात की, हमने इंट्रोसिस मेम्ब्रेन पर बात की, हमने प्रॉक्सिमल एंड डिस्टल टिबियोफिबुलर जॉइंट पर बात की. अब हम जो है बात करेंगे फुट कॉम्प्लेक्स पर, बात करेंगे एंकल पर, बात करेंगे, यानी जो प्रॉक्सिमल एंड डिस्टल टिबियोफिबुलर जॉइंट जो है वो दैट इज द एंड टू दैट. So ankle foot complex, to facilitate description and understanding of that ankle foot complex, the bones of the foot that divide into three functional segments. And these three segments, they are the hind foot, which is also known as the posterior segment, the mid foot, which is also known as the middle segment, the forefoot, which is also known as the interior segment. Out of the 7 tarsal bone, the two posterior, which is also the two largest tarsal bone, the calcaneus and the talus, they both make the hind foot. So hind foot are the posterior segment. Hind foot is also known as the rear foot. So rear foot or the hind foot is composed of the talus and calcaneus. Calcaneus is the largest tarsal bone, while the second largest tarsal bone is the talus. The midfoot or the middle segment that is composed of the navicular, cuboid, and the 3 cuneiform bones. It means out of the total 7 tarsal bone, the posterior 2 large tarsal bone, they make a handful, while the remaining 5, including the navicular, cuboid, and 3 cuneiform bones, these 5 tarsals, they make the midfoot or the middle segment. 3 cuneiform bones mean one is the medial cuneiform, the other is the intermediate, cuneiform, and the other one is the lateral cuneiform bone. While the forefoot, which is also the interior segment, that is composed of the 5 metatarsal and all phalanges. So if we look at this diagram, this has been divided into 3 function segments of that foot. So that is the talus, and this is the calcaneus, and the talus and calcaneus both, they make the hind foot. This is the navicular, this bone as the cuboid, and these 3, 1, 2, 3, these 3 cuneiforms that make 5, 1, 2, 3, 4, 5. This actually known as the midfoot. This is the lateral cuneiform. This is the middle or intermediate cuneiform, and this is the medial cuneiform. Among these 3, that the medial one is slightly larger than the other 2. And then the 5 metatarsals and the phalanges, they make the 4 foot, which is actually the interior segment. This is the middle segment, and this is the right segment or the posterior segment. So that was the division of the foot bones into the hind foot, midfoot, and the forefoot. This is another diagram showing these 3 functional segments from the lateral side. This is the calcaneus and talus. So from this area, this posterior segment, this is known as the right foot or hind foot, talus and calcaneus. The navicular bone, which is attached to the talus, and the cuboid, which is attached to the calcaneus. You can remember these 2, that C calcaneus and C cuboid. So that Kaku, that CC, that is actually the 2 bones. The cuboid is present on the lateral side, while navicular is present on the medial side. So the navicular is connected with the talus, while the cuboid is connected with the calcaneus. There is connection of the navicular and cuboid as well, while the navicular is also connected with the 3 cuneiform bones, which are the lateral, middle, and the medial one. So that is the middle segment, the midfoot, and then the 5 metatarsals, and then the phalanges, they are making the interior foot or the forefoot. These are the metatarsal phalangeal joints, and these are the tarsometatarsal joints, while this is the intertarsal joint. This is the subtalar joint, while this is known as the ankle joint, which will be discussed in the upcoming slides. So ankle are the ankle joint, which is also known as the talocrural joint. And this term, ankle, specifically refers to the talocrural joint, the formation of the hematoids, a hole by the medial malleoli, which is on the tibial side, and the lateral malleoli of the fibula, with the talus lying in between them, make up the talocrural joint. The ankle is a synovial hinge joint with giant capsule and associated ligaments. It's generally considered to have a single oblique axis with 1 degree of freedom. 1 degree of freedom means that is only permitting movement in a single direction, and that single direction, single plane movement, sagittal plane movements, that is the dorsiflexion and the plantar flexion. These 2 movements are actually the movements of the ankle joint. This is the X-ray, the radiograph showing the ankle joint. This larger bone, this is the tibia, this is the fibula. This is that surface of the tibia. This is the ankle joint. This area, this is actually known as the medial malleolus and medial malleoli. This is known as the lateral malleolus. This is the sulcus, which is also known as the malleolar fossa or that sulcus. That is actually known as the matrice, that is the talus bone. If we look at the 2 malleoli here, The lateral malleoli are the fibular malleoli. This is much more distal than the medial one. If we look here, this line, which is the line indicating that a talus bone, on the lateral side, there is also bone here, and some part of the bone is also present just below this line on the lateral side. While here, there is no such bone. It means on the middle side, that malleoli, the medial malleoli is shorter in sense of that distal elongation, while the lateral malleoli is more distal. This is in length. Similarly, if we look at the this tibial surface, the tibia is more distal posteriorly as compared to the anteriorly. Anteriorly, it is less distal than the posterior one. That is that actually joint between the distal end of the tibia and distal end of the fibula, known as the distal tibiofibular joint. The ankle joint proximal articular surface that is actually composed of the concave surface of the distal tibia and the tibial and fibular malleoli. If we look at the slide on the previous slide, so that is actually known as the proximal articular surface of the ankle joint, which is made of the distal or the inferior surface of that tibia, and the medial and the lateral malleoli are the tibial malleoli and the fibular malleoli. These three facets form an almost continuous concave joint surface, and that is continuous concave joint surface. This concave joint surface that extend more distally on the fibular lateral side, as we can see here, than the medial side, and more distally on the posterior margin of the tibia than on the interior margin, as we discussed in the previous slide. The structure of the distal tibia and the malleoli is referred to as matrice. This is that more distal than the medial one, while this is that more distal than the interior one. This is actually the posterior view of the ankle joint. The distal articular surface, that is the body of the talus, form the distal articulation of the ankle joint, and the body of the talus has three articular surfaces: large lateral surface, which is also known as the fibular surface, which is triangular in shape. So that large lateral facet is also known as the fibular facet, while a small medial facet, also known as the tibial facet, is a comma shaped, and a trochlear facet, which is actually the superior facet. The body of talus also appears wider interiorly than posteriorly, which gives it a wedge shape. It means that is more wider interiorly and that is narrower at the posterior end, which gives a wedge shape. The articular cartilage covering the trachea is continuous with the cartilage covering the more extensive lateral facet and the smaller medial facet. The structural integrity of the ankle joint is maintained throughout the range of motion of the joint by a number of important ligaments, which we call as the medial and lateral ligaments of the ankle joint, which will be discussed in the upcoming slides. So this is actually the body of the talus with its trochlear superior surface. The medial are the tibial facet, and the lateral are the fibular facet, which form the distal aspect of the ankle joint. The subtalar joint, which is also known as the talocalcaneal or joint, is the joint between the talus and calcaneus, and that is a composite joint formed by the three separate plane articulation between the talus superiorly and calcaneus inferiorly. This subtalar joint provides a triplanar movement around a single joint axis. And the articulation, if we talk about the articular surface, the posterior talocalcaneal articulations, they have the largest concave facet, which is on the body of talus, and the convex facet, which is in the calcaneus superior surface. The interior and medial talocalcaneal articulation, the convex facet is actually on the inferior body and neck of talus respectively, while the concave facet is on the calcaneus. Between the posterior articulation and interior and middle articulation, a bony tunnel is present formed by a sulcus concavo in the inferior talus and a superior calcaneus, and this tunnel is actually known as the tarsal canal. So this is actually the different surface of the calcaneus. If we look at this surface, this is the lateral surface. This is the plantar surface. This is the medial surface. This is the lateral surface. This is the posterior one. Here is that point where the calcaneus tendon attached. If you look at the lateral surface is rough and almost flat. There is two projection, we can say that, or we can say outgrowth. One is the fibular trochlea, and the other is that attachment of the calcaneofibular part of the lateral collateral ligament on the ankle joint on this posterior superior tubercle. There are three surfaces which are for that subtalar joint: the posterior talar articular surface, the interior talar articular surface, and the middle talar articular surface. And this is the calcaneus tubercle. This is the notch which is present between the two projections. The broader and larger medial projection, which is known as the medial process, while the lateral and smaller projection is known as the lateral process. This is a groove for the tendon of the flexor hallucis longus. And if we look at this surface, these are the three surfaces. The larger one is that posterior talar articular surface, and these two are the interior and middle talar articular surfaces. If we look at on the medial side, there is a lateral side, a medial side projection, which is actually known as the substanticulum tali. There is the upper part of the posterior surface, and this is the middle part of the posterior surface, while this one is the lower part of the posterior surface. This is for that calcaneocuboid joint, which is the joint between the cuboid and the calcaneus. So there are different surfaces of the calcaneus bone. So these are some discussion of these three surfaces: the medial side, the lateral side, the posterior surface, the plantar surface, and the lateral surface. Tarsal canal. The tarsal canal has two ends. One is the larger end, the other is the smaller end. The larger end, sinus tarsi, that lies interior to the fibular malleolus, while the smaller end that lies posterior to the tibial malleolus. It means that the interior end is larger while the posterior end is smaller. That is an oblique canal, which interiorly it is interior to the malleolus, while posteriorly it is posterior to the malleolus. If we further talk about this tarsal canal, uh, above a bony horizontal shape, a calcaneus is called as sustentaculum tilli, which we discussed in the previous slide. This is that projection which we call as the sustentaculum tilli. Posterior articulation has its own capsule. Interior and middle articulation share a capsule with the talonavicular joints. Now we will talk about the ligaments which will support the ankle joints, and all the ligaments of the ankle joints, they can be categorized into two major groups. That is the medial collateral ligaments and the lateral collateral ligament are simply the medial ligaments and the lateral ligaments. The medial collateral ligament MCL, that is the most commonly called as the deltoid ligament. Their origin, insertion, or their attachment, they're attached from the tibial malleolus and insert in a continuous line on the navicular bone anteriorly and on the talus and calcaneus distally and posteriorly. So these are the bands, or we can say that the part of that deltoid ligament. This ligaments, which actually that is the posterior, this is the tibial end and the medial side. This is their superior attachment. There is inferior attachment. They have a common superior attachment, but below they have a superior attachment. So that's why somehow they are also called considered as not separate ligament, but they are considered as the band of the deltoid ligament. This one is the posterior tibio-talar ligament, which is between the tibia and talar. This one is the tibiocalcaneal ligament. The ligament is between the tibia and the calcaneus bone. This one, the most interior one, that superior one, that is actually the tibio-talar ligament. Again, it is between the talus bone and the tibia, which is this is the posterior tibio-talar. This is the interior tibio-talar. While this ligament, this is between the tibia and the navicular bone. So these four ligaments are bands that are collectively known as the deltoid ligament. These internal stabilizers are for the tibiocalcaneal joints, and which actually we can call as the the tibio joint, which we call as the ankle joint. And these ligaments are bands are the tibiocalcaneal ligaments, the tibionavicular ligaments, interior tibiotibial ligament and the posterior tibiotibial ligament, which we discussed from here, they are attached. So all of them, they are attached to tibia, and then they are spread inferiorly to the separate attachment to the talus as well as calcaneus as well as the navicular. This is another diagram which is showing as them as the single ligament, deltoid ligament, and they have different fibers or bands: the tibionavicular band, the tibiocalcaneal band, and the tibiotalar band, which are the interior and posterior tibiotalar fibers or band. These are then the intertarsal ligaments, which is actually the talonavicular ligament and the uh, navicular ligament. These two are present on the dorsal surface. That's why they are known as the dorsal ligaments. And these are the ligaments which give support and stability to the tarsal joint. That's why they are known as the tarsal ligaments. This is the long plantar ligament. This is the tendon of tibialis posterior. This is the Achilles tendon. The medial collateral ligament control and limit the medial distraction stress on the ankle joint, limit motion at the extremes of joint range, particularly with calcaneal eversion. The lateral collateral ligaments are also known as the lateral ankle ligaments. They are composed of three separate bands. Or why they are known as the separate band or separate ligaments? Because unlike the deltoid ligament on the middle side, the lateral ligament, they have separate attachments both superiorly as well as inferiorly. While on the middle side, the deltoid ligament superior attachment is the common, but and the inferior attachment they are then separate on the that navicular talus and calcaneus. So these are composed of three separate bands that are commonly referred as separate ligaments, unlike the medial collateral ligaments. These are the anterior and posterior talofibular ligament and the calcaneofibular ligament. The function of the LCL ligament is that it controls the various stresses that result in lateral destruction of the joint. It also checks extremes of joint range of motion, particularly calcaneal inversion. So if we look at these, they have separate attachments. So this is the ATFL, which is the anterior talofibular ligament. This one is the CFL, which is the calcaneofibular ligament, and that one is the PTFL, which is the posterior talofibular ligament. These three ligaments, they are known as the lateral collateral ligament or the lateral ankle ligaments. Among these three ligaments, the anterior talofibular ligament is the most commonly injured ligament. And after that, the ligament which is most commonly involved in injury, this is the calcaneofibular ligament. Because of its short nature, it is short and wide, this posterior talofibular ligament, this is very rarely injured. And if this ligament is also ruptured, if there is also tear and sprain of this posterior talofibular ligament, it means that the injury was a high energy trauma, and there may be fracture as well at the upper two bones, either most commonly at the tibia, but maybe at the fibula. So these are the grade. We can say that the uh, stages are that severity of the sprain. One is known as the grade 1, the grade 2, and the grade 3. There is no tear at the grade 1. There are micro tears. There is just overstretching and a very minute microscopic tear, which is we can't consider them as tear at those ligaments. And the grade 2, there is partial tear. Some fibers they have been torn, while the other fibers they are still intact and still there and contract and continues. Grade 3 sprain, that actually known as the complete rupture of the ligament. There is discontinuity of all the fibers, of all the ligament fibers from each other. This is that ligament which is actually most commonly involved and most common injured ligament, not among these lateral ligament, but among all ligaments of the ankle and foot complex. So ankle sprain, this is a very common sports injury, as well as it is also very common among general population when they are walking on any one surface and when they are walking at uncomfortable shoes, specifically if they have high heels and the surface is uneven, then there is high chances of the injury of a sprain of these lateral ligaments. The mechanism of this injury is there is inversion at the subtalar joint. due to which there is overstretching of these lateral ligaments, which lead to the rupture or sprain of these ligaments. So this is the grade 1. This is just micro tears. This is the grade 2. You can see here, there is a partial rupture and there is rupture of some fibers while some fibers still intact. And this is the grade 3, when there is complete tear of the ligaments. There is discontinuity from one side to other. There is no fiber which is still intact. When there is grade 3 of the ATF fill, it means there may be a grade 1 tear of the posterior talofibular ligament as well. Because when there is complete rupture of this ligament, it means that there would be a very high trauma injury, high trauma, high energy trauma that will lead to some damage to the posterior ligament as well. So this is inversion mechanism. When there is inversion of that foot, there is overstretching on the ligaments on the lateral side, which somehow may have rupture as well. In this case, if we look at this picture, there is complete rupture of this ATF field, as well as there is complete rupture of this ligament. So we can call as the type 3 sprain, when there is complete tearing of the ligament. And these are the summary of the ligaments which we discussed in the previous slides. The ankle ligaments, that is the lateral ligaments. These are the medial ligaments known as the deltoid ligaments. This is the ATFL, the PTFL, and as well as the calcaneofibular ligaments. Other major ligaments of the foot that will be discussed in the next lecture, inshallah. Thank you so much to all of you.